Marijuana, also known as cannabis, is a psychoactive drug derived from the Cannabis sativa plant. It contains compounds called cannabinoids, the most well-known of which are tetrahydrocannabinol, THC, and cannabidiol, CBD. When consumed, marijuana interacts with the brain's endocannabinoid system, which plays a crucial role in regulating various physiological processes, including mood, memory, pain sensation, and appetite. Short-term effects. Euphoria and relaxation. THC, the primary psychoactive compound in marijuana, binds to cannabinoid receptors in the brain, leading to the release of dopamine, a neurotransmitter associated with pleasure and reward. This can result in feelings of euphoria, relaxation, and heightened sensory perception. Impaired memory and cognition. Marijuana use can impair short-term memory, attention, and cognitive function, particularly in tasks requiring concentration and coordination. This is because THC disrupts the functioning of the hippocampus, a brain region involved in memory formation and learning. Altered perception of time and space. Marijuana can distort the perception of time, leading to a sense of time dilation or compression. Users may also experience changes in sensory perception, such as enhanced colors, sounds, and tastes. Increased heart rate and blood pressure. THC can temporarily increase heart rate and blood pressure, which may pose risks for individuals with cardiovascular conditions or predispositions. Dry mouth and red eyes. Marijuana use commonly causes dry mouth, cotton mouth, and redness of the eyes due to the dilation of blood vessels. Long-term effects. Cognitive impairment. Chronic marijuana use has been associated with long-term cognitive deficits, particularly in memory, attention, and executive function. Prolonged exposure to THC during adolescence, a critical period of brain development, may have lasting effects on cognitive abilities and academic performance. Addiction and dependence. While marijuana is often considered less addictive than other drugs, long-term use can lead to the development of dependence and addiction, particularly in individuals with a predisposition to substance abuse disorders. Withdrawal symptoms such as irritability, insomnia, and decreased appetite may occur upon cessation of use. Psychiatric disorders. Some research suggests that marijuana use, particularly in adolescents, may increase the risk of developing psychiatric disorders such as schizophrenia, depression, and anxiety disorders. However, the causal relationship between marijuana uses and these conditions is complex and not fully understood. Respiratory issues. Smoking marijuana, like tobacco, can irritate the respiratory system and lead to respiratory problems such as chronic bronchitis and coughing. Additionally, long-term marijuana smoking may increase the risk of lung infections and respiratory complications. Impact on brain structure and function. Long-term marijuana use has been associated with alterations in brain structure and function, particularly in regions rich in cannabinoid receptors, such as the prefrontal cortex and amygdala. These changes may affect cognitive processing, emotional regulation, and decision-making abilities. Medical benefits. Despite its potential risks, marijuana also has medical uses and therapeutic benefits. CBD, another compound found in marijuana, has been shown to have anti-inflammatory, analgesic, and anxiolytic properties. Medical marijuana is commonly used to alleviate symptoms associated with chronic pain, chemotherapy-induced nausea and vomiting, multiple sclerosis, and epilepsy. Marijuana exerts complex effects on the brain, influencing various cognitive, emotional, and physiological processes. While acute marijuana use may result in euphoria, relaxation, and altered perception, chronic use can lead to long-term cognitive deficits, addiction, psychiatric disorders, and respiratory issues. It is essential for individuals to weigh the potential risks and benefits of marijuana use and make informed decisions regarding its consumption. Additionally, further research is needed to better understand the long-term consequences of marijuana use and its potential therapeutic applications.